Today we're going to be diving into some practical solutions to a very common problem.
What's one example of something tough that's happening for your workforce? One Gallup survey showed that 3 out of 4 people working in this country feel burned out at least sometimes. During the pandemic, over 40% of Americans experienced symptoms of a depressive or anxiety disorder, and the WHO estimates that depression and anxiety cost the global economy over $1 trillion per year in lost productivity. Thousands of people in your organizations have likely been impacted by something that has transformed their world, that has turned things upside down, and that is expected to have an impact in how they behave at home and at work. I think we can agree that the world is not the way it used to be. A whole lot has changed in a very short period of time. And so the question is not, do we have to change our leadership approach? It's how. We want to prioritize employee well-being, create human-centered spaces, a healing-centered organization with humanistic practices. Can we invest in a culture of wellness and have a resilience-informed approach? And there are articles popping up in popular media everywhere about trauma and trauma-informed care. So it's really an exciting time to be doing this work. What we know from loads of scientific research is that stress alters the brain, which then goes ahead and impacts the body, which in turn affects our behaviors. And we can learn to recognize these signs at work. How can I help everyone feel safe and supported and empowered to do their jobs while showing up as their authentic selves? Well, I have more answers for you. What I'm about to share with you is, I think, the most powerful tool in my career. You do not have to be a therapist to be therapeutic. I will say that again. You do not have to be a therapist to be therapeutic. We all have the potential to heal.
I think this presentation on trauma-informed leadership was excellent. It's definitely what we need in the United States right now. All of her concepts, I think, are right on target. It improves the work life for everyone.
Sadie really brought a lot of peace and a lot of structure to an area that I think is a sensitive topic that a lot of individuals are afraid to speak on, but needs to be heard, and it needs to be made sure to be regulated and shared out there.
I thought it was a great presentation and anybody can use it.
Dr. Elisseou's presentation was amazing, but I think the word that comes to mind right now, it was necessary. You know, when you listen to her speak, she doesn't waste any words. Like, every word was very deliberately placed. She is a clear master in the content, and I think, you know, her presentation delivery really enhanced the topic as a whole. I liked how her presentation was really full of actionable things. I really enjoyed her talk.
Resilience does not mean that you're not bothered. Resilience only means that you choose to take another step forward, that you live to see another day.
Grounding and peace, it doesn't take a lot of time. It takes a decision and an action.
Maybe we find a new opportunity, a new path, a new calling, a new hope, a new mission.
And so we need to implement trauma-informed approaches on the individual, interpersonal, institutional, and systemic levels for us to move towards healing, recognizing that burnout is a national crisis.
The fact is, it's completely applicable. It has infinite applications. The world should be trauma-informed.